By Aneri Pattani, Kaiser Health News. It had been months since Tremellia Hobbs had an excuse to bring out the pompoms. Before the coronavirus pandemic, they were a crowd favorite at movie nights and bingo tournaments that Hobbs organized as activities director at the Bryan Center Health and Retirement, Cabarrus nursing home, in Concord, North Carolina. On January 14, she finally had a reason. After nearly a year of living with pandemic restrictions and a summer outbreak that killed 10 residents and infected 30 staff members, the nursing home was hosting its first coronavirus vaccine clinic. So Hobbs lifted the red and silver tassels into the air and cheered as her co-workers lined up to get shots from two visiting CVS pharmacists. Stewart, he's our man. If he can't do it, no one can. Gooo, Stewart. But even as Hobbs rooted for her colleagues, decorated the dining hall with green and blue balloons, and assembled goodie bags with Lifesavers gummies for those who received their shots, she knew she wouldn't be getting the vaccine herself. Being able to diagnose, come up with a vaccine and administer it all within the same year just seems a little puzzling, she said. I would like to give it a little more time. Hobbs' hesitancy has been echoed by nursing home staff members across the state and country. But her reasoning, as well as that of her colleagues who also opted against the vaccine that day, goes far beyond a simple yes or no. The decision is complicated and multifaceted, they said, which means persuading them to say yes will be too. In North Carolina, the health secretary has said more than half of nursing home workers are declining the vaccine. A national survey found that 15% of healthcare workers who had been offered the vaccine said no, with nursing home personnel more likely to refuse than hospital staffers. The trend has concerned public health officials, who say vaccines are among the best ways to protect vulnerable elders at long-term care facilities who may be infected by asymptomatic staff members. Although such facilities house less than 1% of the nation's population, they've accounted for 37% of coronavirus-related deaths, according to the COVID Tracking Project. Early reports suggest nursing home residents are getting vaccinated at a higher rate than workers. An analysis of more than 11,000 long-term care facilities, conducted by the U.S. Centers for Disease Control and Prevention, found that in the first month of vaccinations, about 78% of residents got at least one dose, but only 38% of staffers did. But some nursing home staffers say their reluctance is being misconstrued. Most are not saying they'll never take the vaccine, but simply that they have concerns about such a new product.